Today, we're talking about how to keep kids and teachers safe back in school, what to expect this fall and winter, and how to assess your own risk tolerance. Here to sort through all of this, I am thrilled now to be joined by Dr. Sten Vermund. He is Dean and Professor of Yale School of Public Health, a pediatrician and infectious disease epidemiologist. And he's very involved in health policy and coronavirus pandemic response and prevention. Dr. Vermund, thank you so much for your time.
My pleasure.
So I just wanted to jump right into it. School has been in session for a month in some places. New York City is back today. I know that you've been advising some schools. Would you give us sort of your high-level advice? How are schools and teachers meant to stay safe back in class through this fall?
We do have a difference between upper school and lower school, high school and grade school, if you will. We do have a chance for high schools to be fully vaccinated. And that is a real gift because the vaccine is very effective, very safe, and likely to reduce not only symptomatic case loads, but the complications from coronavirus. So we're very keen to continue striving for very high vaccination rates in high schools or upper schools where the vaccine is available. We also have challenges in the lower schools since we don't yet have a vaccine available for the younger children. And we are going to be relying on classic public health prevention strategies for respiratory viruses. We've had masks and physical distancing, hand hygiene, improved air quality within schools, all of which remain highly relevant and helpful strategies for mitigating risk.
First of all, when we're talking about the vaccinated kids in the upper school, do you still advise that they wear masks in class? And what kind of ventilation do you suggest?
That will depend a lot on the background epidemiologic conditions in a community. Now, the schools in New York City, the schools in Connecticut, elsewhere, are playing it safe for a few weeks as school is being launched. And we are looking at universal mask use. We're looking at physical distancing insofar as we're able to operationalize it. And you asked about internal air quality. All of the advice that we've given to schools last year to improve the filters in their systems, so-called MERV 13, MERV 13 filter or higher, which actually can capture more viral particles, higher flow rates so that you can get perhaps 6 full air exchanges per hour rather than 2 or 3. You can mix in external air when that's possible, when your system enables you to mix outdoor air into your system. Sadly, all of these things are not as energy efficient. And with global warming, we want to be as energy efficient as possible. But we do think the health of our children trumps that issue for the time being. And we are going to have to be using a little more energy to keep the air quality safe. So all of these things are excellent down modulators of risk. And we were doing a remarkably good job keeping our children safe in the last school year, and we can do the same this year.
Am I correct that it's your view that a lot of this excessive demonstration of hygiene, wiping things down all the time, is less important than excellent ventilation, for example?
I believe it is less important. I was never quite the fan of some of the over-the-top cleansing strategies because of the evidence that we would have substantial transmission by surfaces is really quite weak. Respiratory viruses are transmitted through respiratory processes. So if I am infected and I cough, that is a menace. I might cough and then inoculate a surface, and that is also a risk. But when you're fastidious with your hand hygiene, you can protect yourself from contaminated surfaces. For example, I never hesitate to open a door using my hand on a dirty doorknob, and then I hand hygiene after I've touched that surface. So if I then scratch my nose, I'm scratching my nose with a sterilized hand, if you will, and those are the sorts of habits that we can inculcate in our children as well, so that if they touch a contaminated surface, they need to hand hygiene. And
Does that mean giving them sterilizer? Sorry, like Purell
sure,
equivalents?
having the alcohol-based hand cleansers widely available in schools, as they tend to be, and also parents ensuring that they have a little hand sanitizer bottle when that's available. And at that point, you're not wiping down every imaginable surface in the school multiple times a day, which is simply not sustainable and not practical, and probably not necessary. I do think as I say, respiratory viruses are transmitted through the air. So masks are helpful, excellent. Air quality is helpful. If you're in an old building that doesn't have what we call HVAC, heating, ventilation, air conditioning, HVAC system, you can use portable air purifiers. If cost is a limitation, we have strategies to use a box fan, $40 from the local hardware store, and put a MERV 13 filter taped to the front of the box fan and pull air through the filter to create a very low cost. I mean, that whole thing would cost $60, $65 at the most. And you can have amazing air filtration in dead spaces of your school building. And you can do that with a $400, $500 air purifier, or you can do it with a $65 box fan taped with the blue painter's tape, taping a MERV 13 filter or higher to that. So there are all sorts of strategies that we've been advising schools on how to keep the children safe.
That is a great substantive tip. Another question I get from parents and teachers often is, what mask do you recommend?
I'm more keen on children wearing a double ply mask of any sort that is comfortable for them and that they're motivated to wear. The double ply is the key. So it could be a double ply cloth mask, like I often use, or a double ply surgical mask. And either one is likely to substantially reduce a child's risk of getting infected or infecting someone else if they happen to be infected.
And does it just say that on the box, double ply?
Yes, it should say it on the box, and you can actually tell in a cloth product. You can take the two. Ply apart. It's very easy to tell. And in a surgical mask, you can actually see them, and you can pull them apart as well. They're often different colors, so it's easier to do than one might think. And I've seen a lot written about masks, about KN95s, N95s. I mean, if you're a healthcare worker, or if you're going on a 12-hour flight from New York to Beijing, I certainly would recommend paying attention to the quality of your mask. But in the ordinary circumstance, I'd rather one that was comfortable, that fit comfortably, and that you or your child will actually wear.
Let's talk for a moment about teachers, because I have a lot of teachers in the audience who say to me, you guys are always talking about the kids, but we're the ones who are constantly exposed, especially to unvaccinated kids, the little ones. Would you recommend they wear, for example, a KN95?
I'm not wearing KN95. I'm one of those teachers. I teach at my school. Now, I'm teaching a few hours a week in graduate school, whereas the teachers are teaching many hours a day. So I don't want to equate myself. But I would like to have a mask where I can be comfortable. And that, to me, is my number one priority, because I don't ever want to be tempted to take that mask off. I want it to fit over my beard, over my nose. I don't want it slipping down. I want it to be something that is practical for me to use. And if I were a teacher and I had an immunosuppressive disease, I was battling cancer, or I had the HIV virus, or I had a rheumatologic disease, which to manage it, I had to take immunosuppressive drugs, any number of a whole raft of conditions, then I probably would wear a higher quality mask. For example, if I work in the hospital and I'm actually in contact with patients, I use a high quality mask.
I want to go back to talking about the classroom setting and ask a little bit about the little ones who are not yet vaccinated. And I'm mindful of the fact that you said it's all very dependent on your larger community. So for our hypothetical, let's imagine a community where there is significant spread. And so there are concerns. What's the best way to keep the unvaccinated little ones safe in school right now?
We've had excellent success, more than I might have guessed, in mobilizing small children to wear masks. The best teachers and the best principals and the most successful parents have recruited our little ones as a tiny little army to battle this virus. And I see so many children proud to wear their mask, willing to wear their mask. It breaks my heart when I have an anti-mask parent who sort of undermines that morale in the child who can wear a mask that may be sort of branded with their school mascot. Perhaps it's their favorite cartoon character. Perhaps it's their favorite superhero. Maybe a creative parent has actually made a cloth mask with the child, so the child feels that they own this mask, or the child's picked out the prettiest or most interesting pattern, and they feel some sense of ownership. And the parent who and the teachers who are reminding the child that this is a nationwide, worldwide battle against this terrible virus, that we can all play our part, and almost building a school spirit and a spirit in the household that appreciates why this is important. And I've seen so many children step up to the plate and feel ownership of this and feel empowered to help in this battle against the pandemic. Ironically, if you'd asked me a year and a half ago, who's going to do the best, I would have said, oh, these little kids, they're really going to struggle. It's going to be really tough for them. But I think our teenagers are going to get it. It turned out I was exactly wrong. The teenagers tend to get more mask fatigue. They tend to be sort of blowing it off more. You know, you've got the rebelliousness and the sense of invulnerability of the teen. And so we've had to work especially hard with the teenagers, which makes the advent of the vaccine for them that much more convenient. Now, I will say the younger children can have mask fatigue. I don't want to trivialize the difficulties, but there are all sorts of strategies for little mask breaks. The people going outside and foregoing mask use because they're outdoors, and there are ways of breaking up the day so that they're not literally wearing a mask the way that a surgeon is wearing it in a 10-hour, surgical procedure. We don't need that.
But would you send your child to school in an environment where there is no mask mandate, especially if they're not vaccinated?
I would do everything in my power to try to influence the school district the way that many parents have done in several states, Florida and Texas most notably. Many school districts are going with universal mask policies, even though the governor of the state has said you can't do that. And they're going to court. And I believe that they will win and the governor will lose.
What would you advise parents who are concerned in the meantime, while these cases are working their way through the courts or they're trying to get the state to change their policy? They have to make a decision. Will they send their kids to school with no mask mandate or not? Some are asking, should they homeschool their kids in the meantime? What do you say to them?
I would think that the details matter a lot. So if my principal of my child's school is able to enable mask use by a substantial proportion of the children. If I can have some physical distancing from children who are not masked, if I can eat apart from those children, if there were reasonable precautions being established at my school, I might feel comfortable sending my child. If no provision is being made to keep my child safe, I think an alternative approach, such as looking for hybrid learning, if the school is able to enable me to have facilitated education from home, that would not be an irrational decision. I do feel, though, that children do lose a lot not being in school. They lose the ability to socialize. They lose the ability to learn how to socialize. Not every child is favored by the best computer and the best internet access. Children of white-collar parents might have their parents at home available to oversee their work, but blue-collar parents may be out in the community and not home to supervise their children. So there are a lot of specifics which might alter a particular parent's judgment as to the relative benefits or risks of going to school.
So how would you advise then the children who, let's say we're kids who are in school, how should the vaccinated children interact with the unvaccinated?
Well, the vaccinated children are very fortunate because the risk of acquiring symptomatic disease is diminished. The risk of serious disease is radically diminished. So they do have an immunological gauntlet that the virus has to run that is going to be tremendously protective for them. So if my child is vaccinated, I'm a lot more comfortable sending them to a school than if my child is unvaccinated. If a child gets COVID, they're far less likely to be symptomatic and far less likely to be seriously ill.
Even with Delta.
Even with Delta. Now, having said that, we're seeing a doubling, in some venues quadrupling, of children hospitalized for COVID because of Delta. So if you quadruple a very tiny number, you still have a reasonably tiny number. But there are hospitals around the country that have seen a lot more children hospitalized because of COVID in the Delta era. So that's why I'm so much more comfortable if my child is vaccinated, because the likelihood of the vaccinated child being hospitalized is remote.
What is the safest way for especially unvaccinated children in school to eat lunch? If they're eating lunch outdoors, is that safe? Is there any evidence of outdoor transmission?
The great outdoors are one of the great gifts in COVID protection. You have tremendous dilutional benefit of outdoor air. So if a child is infectious to another, just being outdoors dilutes that child's aerosols immensely. You often have a little breeze outdoors, and so it's much safer eating outdoors than indoors. I sort of think of my life and the life of small children in the size of boxes. So my car is my smallest box. My room is my next smallest box. My classroom is a little bit bigger box. My gymnasium is a much bigger box, or my auditorium. And the great outdoors is the biggest box of all. And I want to stay in a bigger box. And if I'm in a smaller box, I want it to mimic a bigger box. When I'm driving in the car, I want to leave the windows open. When I'm in a small space like a classroom, I want to have my ventilation going full blast. So the bigger the box, the better, and outdoors is the biggest box of all. So I'm much more comfortable eating outdoors than indoors. Some schools have been creative in their scheduling, where they might have had 2 lunch hours. They've created 3 through adjustment of their lunch hour periods and some flexibility in their classroom time. So I do think that many schools have been able to manage physical separation. For example, they will use the classrooms for lunch hours. You go and get your food, or the food is delivered to you and you're able to use your more physically distanced classroom. So I think all the strategies that schools adopted last year will also be relevant this year until we can get our children vaccinated.
What would you advise if, for example, the mother of an unvaccinated child, the vaccinated mother of an unvaccinated child gets breakthrough Delta? Does that child's whole class quarantine for a week?
We've found that the contact of the contact, that becomes a much more remote risk. So it tends to be the infected person's contacts that are actionable and should be considered for quarantine. But the contacts of the contacts, that is much more remote, and we've not seen a lot of super spreader events from the contacts of the contacts. So I would answer that the same way that the CDC would answer, which is that let's concentrate on the direct contacts of the infected individual, and we can mitigate risk that way without overdoing it. Because
So
I
if
mean,
the
you'll
child tests positive, that's when to take
that's
action,
correct.
not if the mother of the child tests positive.
Correct.
Okay.
Because we'll just be shutting down schools, workplaces,
All the time.
public transportation. I mean, it's a mess. And we found last year that that wasn't necessary.
Okay. You've said a number of times over and over that the vaccine is safe. A lot of people, though, who have young kids are very nervous about it for young children. Assuming it gets FDA approval, would you have your grandchildren get the vaccine?
The reason we don't have a vaccine for children is because the trials are being done at the present moment. And when the FDA found that a small number of teenagers had vasculitis, inflammation of their vessels, particularly boys, they demanded that the trials study that and also increase the number of children being studied. And we also found that girls of childbearing age with the AstraZeneca product, which is not used in the U.S. because it's not gone through FDA review, but it's heavily used in Europe. They found that the blood clots were more common. So they are studying these things intensively. And you can believe me when I say that the FDA has no intention of approving COVID vaccines unless they're proven safe in children. So the emergency use authorization extended to children will only be done if it's demonstrated to be safe and efficacious. So my answer is, if the FDA approves emergency use authorization for selected COVID vaccines in children, I would be happy to have grandchildren or children vaccinated. I would be enthusiastic because COVID is a potentially very serious disease. It's costing our economy trillions and trillions of dollars. More than 400 children have died of COVID. An additional many hundreds have had the inflammatory condition, the so-called MISC-C, MISC condition, as well as long COVID in children. There's every reason to want to protect our children from this nasty virus.
Again, in that same vein, if you had a granddaughter or a daughter who was of childbearing age, would you have her take the vaccine? And would you have her take the vaccine if she were pregnant?
The risk of blood clots is far higher with the use of oral contraceptive pills than with the COVID vaccine. It's far higher with COVID itself than the COVID vaccine. So I don't trivialize the risk, and I want to observe my child or my daughter or my granddaughter for this risk, but it is a very rare side effect, and I believe that overwhelmingly people are going to use the product. By the way, it's also a side effect that's been associated selectively with the AstraZeneca product not being used in the US. So I feel that I want to look for any side effects, but they're so rare and the disease is so common that I would rather take the risk of an exceedingly rare and manageable vaccine side effect rather than the disease itself with all of its unpredictabilities.
Can you give us a sense of how you think fall and winter will look with the Delta variant and our current inconsistent patchwork rules around the country?
Well, if you don't mind my highlighting the Northeast for a moment, where you and I live, I think it's looking very promising. We see vaccine rates that are really quite high. I would love to see our southern states follow suit. They have the highest rates now, but if we can share the good news on vaccines and coax and cajole and convince people who are a little bit hesitant to get vaccinated, and if we can turn the corner in the South, that would also be fantastic. The West is doing reasonably well. The Midwest is lagging a bit, but they're working on catching up. And so I'm hoping that the US as one nation can come around to much, much higher vaccine coverage rates. You've got a lot of employers who are fed up. They're being asked to pay for the health care of people who refused vaccination. Now they're hospitalized for COVID. So a lot of employers are saying, look, you've got to get vaccinated if you want to work for our company. And a lot of universities are mandating vaccination. A lot of government agencies are mandating vaccination. So I think you're going to see a lot of people saying, look, we've given people a chance. Now it's the unvaccinated that are driving this pandemic, and we need people to step up to the plate and be socially responsible and get vaccinated. So I think you're going to see increasing numbers of people vaccinated. I think most parents are going to be extremely enthusiastic to vaccinate their children once that becomes an option. And I'm hoping we'll see the demise of coronavirus in the United States. We do have the worry of respiratory virus season. It's more popularly called flu season, and it typically runs from Thanksgiving to the Ides of March and middle to late March. And this is when influenza, rhinoviruses, other coronaviruses, respiratory syncytia virus, this whole big family of respiratory viruses are more common because they like the cooler, drier indoor weather. And that's very facilitative of respiratory virus transmission. So what we'd really love to do is get coronavirus down to the lowest possible level so it doesn't have as much an opportunity to surge in respiratory virus or flu season.
Would you go to a 200-person indoor wedding without a mask where people aren't masked?
It's funny you should ask that, since I had that facing me recently. And the answer is no. I would try to avoid a potential super spreader event unless I had some indication that vaccination rates would be extraordinarily high and that people were willing to wear masks when they weren't eating. And there were some reasonable precautions being taken.
Would you eat at an indoors restaurant right now?
I've used my judgment in those regards. My wife and I have used judgment. We've looked at the crowding circumstances. We've looked at how the ability to physically distance is, and we have eaten indoors. We've used masks, and then we've taken them off to eat. Now, my wife and I are fortunate to both be vaccinated, so we have a certain comfort level. When we do have the option for outdoor eating, we almost always take that option.
And finally, do you think, looking in your crystal ball, that Delta is sort of the worst variant it's gonna really decrease after we get through this Delta surge and we're looking at a much calmer spring, or not necessarily?
Every single unvaccinated person with rip-roaring viral infection is producing variants. And the vaccinated people who get infected much, much less, because they have much more transient viral replication, lower level. So we do need to vaccinate the world. That is, I think, a very important foreign policy judgment that I was pleased when President Biden declared that 500 million doses were going to be provided to the world. Well, we probably need closer to 11.5 to 12 billion doses. So the Europeans, all the donor countries are going to have to step up and try to help the globe control this pandemic. I do think that many of these variants that emerge are not replication competent or not as efficient, and they just die out on their own. And it's plausible that a variant that substantially distorts the architecture of the spike protein will not be a very effective human infecting variant. So it may be that Delta is about as bad as it's going to get, this highly infectious variant. But it's not that much worse in terms of the disease itself. So the main thing about Delta is more infectious, so more people are getting exposed. So I do think that there's reason for cautious optimism. If we can control Delta, all of the variants have been vaccine sensitive. So to date, so the vaccine seems to have enough protective value for all these variants that have emerged to date that it's plausible that we can really drive rates down in the US to very, very low levels.
Well, I think we should stop on that note of cautious optimism, because that's the best we're going to get these days. Dr. Vermund, you're wonderful. Thank you for your compassionate advice and for spending this time with us.
It's my great pleasure. And we do need to have these conversations on a regular basis so that we can all sort of appreciate the challenge that we're facing.
Absolutely. Hi, I'm Jessica Yellin. If you like this video, please click subscribe. And you can click the bell to get notifications when we post new content. Thanks for watching.